Hi, welcome to Case of the Day, and I have a new case this Monday, the 60th, and the title is The Non-Resolving Subsolid Lesion. What would you do? And not all cases are cut and dried. Sometimes there are different approaches to the same case, and this is one of those. A 76-year-old with fever presents with this lesion 3 months ago. CT scan was done, reported as an area of consolidation, but if you see closely, you see that this is a subsolid lesion with a solid or a part solid component, which is obviously greater than 6 millimeters. And so it's a complex lesion that, even at first glance, would be suggestive of adenocarcinoma. But the approach basically is that you wait for 3 months before doing anything and then decide on the next step. Sometimes, if you're absolutely sure and the part solid component is big, as in our patient, you could just do a PET CT and biopsy or resect. Anyway, they waited 3 months, and then 3 months later, there is no change. Look at these pleural tags anteriorly and laterally to the costal pleura. And so now the question is, what do you do, right? It is unchanged. So do you just follow up? Do you do a PET biopsy resection? This is almost certainly a minimally invasive adenocarcinoma. So what will you do? Wait, biopsy, resect, or PET CT and then biopsy, resect? So a reasonable approach would be to do a PET CT and then decide whether you want to do a biopsy or not. If a multidisciplinary meeting is convinced that this is malignant, and if PET shows no spread, you can resect without a biopsy as well. Else biopsy. Well, guess what? The patient had a scan from 2016. Over 9 years, the lesion has grown a little, maybe by about 20%. So maybe it's grown something like zero point 0.3 centimeters per year, 3 millimeters per year. So it's a very slow growing lesion. Now, when you have this information, what do you do? Do you just wait, biopsy, resect, or PET CT and then biopsy, resect? And I'll give you an example of a similar patient, though a little older, 81-year-old. COVID CT showed this subsolid lesion with a significant part solid component. And the question at this time is, what would you do? This patient, right, had scans all the way from 2002, 19 years ago, when the patient was 62 years old. And this was at that time dismissed off as a scar. In fact, 2 months later, it seemed to have reduced in density, so nothing was done. And then a CT was done 3 years later in 2006, and it was denser, but again, it was left alone. As per today's guidelines, this would have been managed, but it was left alone. And then came the scan in 2021, where it's grown, but the growth rate is so slow that you could pretty much decide not to do anything. And then 2 years later, in August 23, a scan was done that didn't show any significant change, which means, again, the rate of growth is really slow. And over 2 years now, it's hardly grown. So the patient, very educated, very intelligent, said that if this is the rate of growth, I don't want to do anything and will keep following up. And that brings us to this, that not every deemed malignant lesion needs aggressive management. A one treatment method or a one treatment fits all approach doesn't work in such settings. And in this patient, I don't know what eventually will happen to the case that I've shown, but active surveillance is always an option. 76-year-old, very slowly growing lesion. Perhaps if the PET doesn't show any spread, you could just decide not to do anything and keep doing a CT every year. And then if it grows faster, maybe remove it. Or if the patient says, I don't want the cancer inside, and I just don't want it in, remove it, then remove it. So, and then do you biopsy it before removing it? Not necessarily. Again, a multidisciplinary meeting really helps, and so does being in a high volume center. Anyway, my WhatsApp channel. Thank you so much for viewing this.